got to the hospital. This happened 7:30 a.m. When I checked the time before the incident happened, it was around 7:30 a.m. When we got to the hospital, the doctor said they were not going to admit me because they needed a police report, they needed a lawyer, they needed many things. My grandma was an illiterate. She couldn't write, she couldn't read. So she told them, okay, start attending to the child. And it wasn't in the GSM days. It was later that year that GSM came in. So she said, okay, she's going to send somebody to the island to get my mom, but they should start treating me. But the doctors utterly refused to start anything. The patients that were there were begging, you know, that they should start treating this girl. This girl is dying, because the two eyes were swinging here and there on my cheeks. But the doctors refused to do anything.
I was unconscious for 3 days. The doctors and the nurses that was there at that 2003, instead of them to start taking care of the necessary thing they're supposed to do, they said it's government law or something like that. They just placed me on bed like that, no treatment, nothing. After that 3 days before they now started the treatment, they said no blood, this, that. My family, where we shot, they started running around to make sure that this saved my life. So the doctor in charge, they said no blood, no money. Without money, you cannot treat patients.
These are women sharing their experiences at a workshop organized by the Network of Disabled Women. The workshop is aimed at training health workers and persons living with disability on sexual reproductive health rights. Founder, Network of Disabled Women, Lois Alter, in her remark, called for more awareness of the Disability Act as enacted by the present administration, as most persons living with disability are not aware of their rights.
Most of us don't know. We don't know where Section 5, subsection 7, or Section 29 is, or what it's talking about. We don't know. So as a person with disability, you need to know your rights. When you are trampled upon, don't forget to mention that this is my right. I know how many times I asked some drivers to move out of an assigned disabled parking, so to allow me park in, because that's my space. I know how many times in Transcorp, in Sheraton, and other places that they have assigned a special parking lot for persons with disabilities. So as persons with disabilities, is a homework being given to us. Even in Hausa, in Igbo language, Yoruba language, you should ask questions. And I will advocate for adult education. Families that know very well that their children or persons with disabilities in their families are not educated, they should employ someone that can teach them some of these things, so they will be aware the basic rights, first of all, before other things follow.
Program Officer of the network, Michael Bryan, identified some of the challenges faced by women and girls living with disability when accessing healthcare facilities.
Some of the key challenges that women with disabilities face while accessing sexual and reproductive health services include stigma and stereotypes, barriers to accessing information and services on sexual and reproductive health and rights. For example, where I understand that most of us are health workers, I know sometimes we have health talks, and most times when we have these health talks, we tend to forget women with disabilities. For example, you have a health talk and you have women that are deaf. You have made no arrangement for sign language interpreters. Then how do you expect that crucial information to get to that category of women? And then unfriendly health personnel. This is a very key challenge that women with disabilities still face today. In some health centers, the health personnel, once they see a woman with a disability coming in, woman on the wheelchair or a deaf woman coming, they say, ah, this woman, she has come with her trouble again. She has come with her Allah. That is the mindset. So there are lots of unfriendly health personnel and services, and then inaccessible infrastructure. Most of our health centers are not accessible.
For the participants, the training is coming at the right time, as most persons living with disability are unaware of their rights. They also share their experiences whenever they approach a healthcare facility.
At the NHIS office, the officer I met, on hearing that I was deaf, I felt changed. She was not happy. Whether she was not happy, I don't know what to say. She asked me to go. I was with my daughter first day. So I told my daughter to listen to her and interpret whatever she was saying to me. But the woman was to send my daughter out. Now after that, I waited outside until a senior, maybe one of their supervisors, came in and I narrated my experience with the officer to him. He now called the officer and I asked her why she did not allow me to register my name. She said she did not believe that I was deaf. So the officer now called me and gave me the form because it was my first time of using my NHIS card. After registering my name, I was told to go to to meet the nurses again who would direct me to doctor.
When she got to the hospital, sun had beaten us, wind had contaminated the sockets, everything had happened to me. When they eventually admitted me and they started treatments. But unfortunately, when they took me for surgery, they said the eyes had been contaminated beyond repair. They couldn't be salvaged. And so they gave my mother the very painful option to totally cut them out. And that was what they did. Had they answered us early enough, at least one eye would have been salvaged. But they didn't. And it pains me because 21 years after, we still hear stories of people going to the hospital and going through the same horror in the hands of nurses and doctors. So that's why I'm really happy that we have health workers here today that can raise awareness and advocate. Because when we hear that doctors, when they swear their Hippocratic oath, right? That's what they call it. It means that lives are supposed to be taken first. That's priority. I don't know how we became, you know, quote and unquote callous, such that we do not regard lives anymore. I feel this is the right time for us to sound the bell, sound the alarm once and again, over and again, until it sinks that life is priority over any other thing.
It will go a long way, though it might not achieve success at the beginning, but it's a long run thing that by the time the advocacy spread, then they might have their rights. The advocacy is okay, but you know, implementation, before the implementation takes place, it may take time. That is why the advocacy needs to be taken to policymakers and the health facilities. Everybody is involved, so we are aware of this advocacy, and the government should try to implement the bill as it is now.
Advice to Nigerians is that first they should be patient. Gradually we may reach there. Little advocacy, creating awareness, because we are far back as a developing nation, which Nigeria is one of them. Because most of the times, if you enter some social gatherings, like hotels, sometimes they don't make provisions. But now we are walking from the sleep. That no, we have to carry these people along. So it's a step in the right direction, but as I said, let there be patience. Gradually, we may reach there.
That bill
that has been passed has not gone round. In fact, mostly the hospital, the private facilities should be able to get these bills. Please, sensitization, mobilization, advocacy, this thing has to be done to carry this.
This is the time that we should increase all advocacy and sensitization of the general public, both medical and health workers, and also the general public about the disability rights. People with disability, they have their rights. This bill has been passed, and the hospitals, they have right to good and quality medical services. So coming to bring stakeholders together to discuss these issues is a very good step in the right direction. So I want to say kudos to the organizers, and I want to also ask them to please step it up and do more, because there's still a long way to go as far as educating the public in this all-important issue is concerned.
Network of Disabled Women is a non-governmental organization that advocates for the welfare and well-being of women and girls living with disability. Emmanuel Onu, News 24 International.